Hello and welcome back to Reason News. North Carolina Senator Thom Tillis delivers a blistering Senate floor speech, his first since announcing his retirement, directly attacking the Republican Party's sweeping Big Beautiful Bill. This dramatic moment comes amid deep divisions in Washington and growing questions about the future of healthcare, party unity, and independent voices in Congress. Just hours after announcing he will not seek re-election, Senator Thom Tillis took to the Senate floor with a pointed message for his party and the nation. The subject: the GOP's massive new domestic policy package, dubbed by supporters as the Big Beautiful Bill. The 940-page bill includes tax cuts, a funding boost for immigration enforcement, and, most controversially, deep Medicaid cuts. The bill narrowly advanced in the Senate over the weekend, passing a procedural vote 51-49. Senator Tillis was one of only two Republicans, alongside Kentucky's Rand Paul, to oppose the measure, joining all Democrats in a rare moment of bipartisanship. In his speech, Senator Tillis did not mince words. He warned that the bill's Medicaid provisions would force his home state to drop over 660,000 residents from their health care plans and would ultimately betray the promise Donald Trump made to protect coverage for vulnerable Americans. Tillis said he had done his own research, consulting state legislative leaders, North Carolina's Democratic governor, and hospital groups. He concluded that the bill would result in a $26 billion cut in federal support for North Carolina alone, a figure federal officials eventually conceded was accurate after initially disputing his estimates. Senator Tillis's opposition centers on two key provisions: Medicaid cuts, which is the bill imposes new caps on provider taxes and changes to state-directed payments, which Tillis argues would devastate state budgets and force coverage losses, and process and deadlines, where Tillis criticized the Senate GOP's rush to meet a self-imposed July 4th deadline, calling the timeline artificial and urging leaders to slow down and rewrite the bill. He also drew a sharp comparison to the Affordable Care Act, warning that the GOP bill will break promises in the same way Democrats did with, quote, "if you like your health care, you can keep it," unquote. Here's a video from Forbes Breaking News.
Mr. President, I spent most of my career in management consulting, managing large, complex enterprise projects, multi-year, thousands of hours, a lot of complexity that take people, process, and technology to make it work. I learned a lot in that career, and I was able to go to the legislature and take that mindset as a member of the minority for 2 terms, and then we got a majority in 2010, and I found myself being the Speaker of the House. Mr. President, we were in the middle of the financial crisis. When I got sworn in January of 2011, North Carolina had a $2 billion shortfall on a $20 billion general revenue fund, and I had 6 months to balance that budget. Well, Mr. President, we did something that had not been done in North Carolina. We took the time to understand every aspect and every dollar that was being spent in government. We determined how to cut government in a way that was sustainable. We cut 12% from the university system budget. Not the rate of growth, but the actual spending. And I had some people say that it was going to be disruptive and the University of North Carolina would never be the same again. But, Mr. President, we did it in a way that was instructed by the operations of the university system. And we did it in a way in concert with the chancellors. And you know what happened, Mr. President? We actually balanced the budget. We did do those cuts. And the last time I checked, the North Carolina university system is still considered one of the greatest systems in the United States of America. Why do I use that example? Because the Medicaid proposal in this bill bears no resemblance to that kind of discipline and due diligence. It has no insights into how these provider tax cuts are going to be absorbed without harming people on Medicare. And even worse, most of my colleagues do not even understand on either side of the aisle the interplay of state-directed payments and the devastating consequences of the funding flows that are going to be before us. Mr. President, here's how I figured out the impact in North Carolina. I used to be Speaker of the House, and I like the Speaker and have a good relationship with the Speaker and the President Pro Tem, so I called them up. And I had my staff ask them if they would do an economic impact assessment on what this proposed bill would do to the Medicaid program in North Carolina. But I didn't want just the view of the Republican partisan staff that reports to the Speaker and the President Pro Tem on how they're going to absorb this bill. I decided to go to Josh Stein, the governor, and I went to his Democrat staff for Medicaid. I asked them to prepare an estimate, independent of the estimate that I had done with fiscal research. But I took a step further, Mr. President. I went to the Hospital Association. I asked 3 different independent groups, a partisan Democrat group, a partisan Republican group of experts, and a nonpartisan group of the Hospital Association to develop an impact assessment independent, not talking, not sharing, reporting to me. And what I found is the best case scenario is about a $26 billion cut. Now, we've got a delay, so it may be 2 years, it may be 1 year. All it does is make that $26 billion happen in year 1 or year 12, but the impact is the same, Mr. President, and it's indisputable. Now, when I actually presented this report that you can find on my website, I had people in the administration say, "You're all wet, you don't know what you're doing." I said, well, why don't we assemble a series of meetings? We're going to provide you our analytics. You go through it, tear it apart. I told Mehmet Oz, who I consider to be one of the most capable people in the Trump administration. He's a brilliant man, and I'd encourage my Democrat colleagues to talk to him. He knows his stuff, and he's very focused on getting efficiencies out of CMS. So we had 3 different conference calls with CMS, with Oz on the phone and on the video, and me on the video. And I said this, guys, I would love nothing more than you to prove me wrong. I would love nothing more for you to tell me it's not $26 billion or $30 billion, that it's $2.6 billion or $2 billion or $200 million. But after 3 different attempts for them to discredit our estimates, the day before yesterday, they admitted that we were right.
Speculation is already swirling that Lara Trump, the president's daughter-in-law and former RNC co-chair, may run for the seat in 2026. Tillis's decision not to run again highlights the growing scarcity of lawmakers willing to break with party leadership. In his retirement statement, Tillis lamented that, quote, leaders who are willing to embrace bipartisanship, compromise and demonstrate independent thinking are becoming an endangered species, unquote. Tillis's stand has exposed rifts within the Republican Party, with several senators, Lisa Murkowski, Rick Scott, Mike Lee, and Cynthia Lummis, initially withholding their votes before ultimately siding with leadership. The Big Beautiful Bill is now set for up to 20 hours of debate and a marathon voting session on amendments starting today. The outcome could have sweeping consequences for healthcare, taxes, and the political landscape heading into the 2026 midterms. For North Carolinians and millions of Americans, the stakes are personal. Tillis warned that the bill's Medicaid cuts would force states to absorb tens of billions in new costs or drop coverage for hundreds of thousands of residents. Hospital groups and state officials have echoed these concerns, warning of a ripple effect on rural hospitals, low-income families, and the broader healthcare system. Senator Tillis, first elected in 2014, has built a reputation for working across the aisle and prioritizing pragmatic solutions. His decision to oppose the Big Beautiful Bill and retire rather than compromise his principles marks a defining moment in his career. Tillis has indicated he may return to the floor to speak further as debate continues. Meanwhile, the Senate prepares for a contentious week, with party leaders scrambling to secure final passage of the bill before the July 4th deadline. Senator Thom Tillis's blistering floor speech and retirement announcement have sent shockwaves through Washington, highlighting deep divisions over healthcare, party loyalty, and the future of independent voices in Congress. As the Senate begins a critical week of debate, the nation watches closely, aware that the decisions made in these chambers will shape shape the lives of millions. We will continue to follow the story as it develops. For now, the question remains, will lawmakers heed Tillis's warning and reconsider the bill, or will party unity prevail at the expense of compromise? Thank you for joining us. Until next time, stay informed, updated, and curious.